It's another episode of the Wow Lifestyle Show. My name is Helena. Today we are discussing reproductive health, and I have two experts here to detail on the topic. We are going for a quick break. When we come back, we'll talk more.
Memory, coordination, confidence. You put more into your baby's development than you think. And now you can put more into every mealtime. Cerelac combines iron, vitamin C, and probiotics to support physical and mental development. Nestle Cerelac, now with Iron Plus. Big nutrition for small tummies.
Nivea Natural Fairness Body Lotion is making women glow with confidence. With a trusted, innovative formula containing unique berry extracts and UV protection to care for and restore the skin's natural, healthy glow. Reveal your beautiful, glowing skin with Natural Fairness Body Lotion from Nivea.
So don't forget your onions, but most importantly, choosing the right oil makes all the difference. That is why I always choose Frytol.
So what's the story behind Frytol?
At Wilma, where Frytol is made, each and every worker wakes up with you in mind.
Really?
And for the millions of other homes too. There, the experts ensure every bottle of Frytol is rich with great taste that creates memories to last their lifetime. That is why I add required amounts of Frytol to taste. Frytol is a cholesterol-free oil fortified with vitamin A.
Now I know why you cook with Frytol.
Yes, and it's the choice of cooking oil in millions of other homes.
Yes, Dad.
Enjoy great tasting meals with Frytol, a cholesterol-free cooking oil fortified with vitamin A. Frytol. Love your food, love your life.
This advertisement has been vetted and approved by the FDA.
Welcome back. My beautiful wake up, my makeup, my nails were done by AJ Hair and Makeovers. Call them for all that you need in terms of makeovers. My beautiful Ankara petals cape was given to me by Helena Fashions. You can call them for all kinds of beautiful capes. Now to our experts. We have Dr. Paul Enin. He is an obstetrics and gynecology consultant specialist at Airport Women's Hospital. Doctor, you're welcome.
Thank you.
We are very happy to have you here. We also have our clinical dietitian, Mr. Stephen Norte. You're welcome, Stephen.
Thank you.
All right. Doctor, before we go on with our interview, Airport Women's Hospital, do you take care of just women?
No, it's a misnomer. We do take care of men and women at the same time.
Okay.
But I would admit that a lot of the volume of patients that we see are women.
Okay.
So we tend to see more women and women's problems. But we do accept men as clients.
I see. I think that will be some way for men to walk in because of the name of the hospital.
Yes.
All right. So we are discussing reproductive health today. Could you please enlighten us on what goes into reproductive health? When we say reproductive health, what do we really mean?
Well, the ultimate aim of reproduction is to be able to procreate, to have children. Hence, when we talk about one's reproductive health, then we're talking about the ability or the capacity to be able to have children. What status is it in? But that usually would depend on the age.
Okay.
Since some people are born with congenital anomalies, they may not be able to procreate. Even from birth, we know they have problems.
Really?
But I do believe that the emphasis of what we're talking about today would probably be focused on men and women and their ability to have children.
Okay, that's true.
And in that context, we may have to leave the congenital ones out and focus on the ability of a man or a woman to have a child.
Okay. So, Stephen, we have you here with us because we want to see how nutrition is related to reproductive health. I've had a lot of calls and messages, people asking about foods that they can eat to improve their reproductive health. How is nutrition related to reproductive health?
Yeah, thank you. I just want to start from this angle. I think doctors already started putting the discussion in perspective for us. So for reproductive or sexual health, you want to, I think it will help if we could put it into three maybe broader contexts, you see. In terms of being able to have children, as he rightly said, and there is a place where you want to have children, but you also want to be able to have the ability to control when, how, and how you go about it. And that can be done with your contraceptive or some kind of birth control. The area of sexual health also that has to do with the process of sexuality so that you not contract other disease in the process of sex or something else. So you are talking about STDs. So those ones also have their role to play when we are talking about sexual health in a broad context. But what we are talking about today is your ability to give birth. But to this side of the discussion, these are people, they want to give birth, but they are not able to do it. And there are a lot of issues that can account for that with both in men and women. But research has shown, we have evidence that diet plays a key role. For instance, in men, typically for inability to produce, it may be a number of issues, but generally we do see people with what we call libido, low sexual drive, your motility of your sperm count, testosterone levels, if they are low. All these things can affect a man's ability to reproduce.
And that has to do with nutrition?
And all these things I've mentioned, nutrition play a key role. Women too, your ovulatory cycle and even some hormonal imbalances can also cause fertility issues. And diet play a key role. In fact, one research shows that improving the quality of your diet and making appropriate lifestyle changes can lead to about 69% improvement in fertility.
Okay, I think that as the conversation goes further, we'll talk about more details. So, doctor, what are some of the causes of sexual dysfunction or reasons why someone may not be fertile, infertility?
Well, it depends on, the stage in life the person is. I mean, for young girls who are very athletic, or who try to lose so much weight in order to fit a model of society, thin, pretty girl, they lose so much weight that it does affect the function of their systems. Okay. Their period may not be regular.
So are we saying that excess physical activity or strenuous for women of reproductive age can lead to infertility?
Absolutely. And that's where I guess my dietitian would come in.
Okay.
The young girls who try to lose weight or who exercise a lot, what you see in the Olympics, most of the Olympic girls do not even have periods. Most of them do not even have periods. That's the impact of weight loss and excessive exercise on your reproductive health.
Wow.
But that may be temporary, so we're not too worried about it. When they go past to the point where they get married and they want to have children, then there are other issues that may impact their reproductive health.
Okay.
And for women, main features are the function of the ovaries. Are the ovaries working well? Are the tubes, fallopian tubes, working well? That's what we call the box. Then the relationship with the other partner, the husband, are they able to have intercourse or not? So those would be the issues. But to focus back on the woman herself, when we talk about ovarian dysfunction, that is the ovaries not performing well, we can determine that usually by going through the history and asking about the menstrual cycle, because the ovary secretes hormones that control the uterus and its functions. Mainly, if a woman doesn't get pregnant in any cycle, they will have their menses.
Okay.
So having menstruation is a failure of pregnancy. That is why we have periods. It is not to clean the womb as it has been. There's that misconception out there. Patients come in, they worry that I've not had a period for 3 to 4 months. Doctor, does it mean that I'm not clean? I need to be cleaned out. But that's not it.
But that can be a fertility problem, like
that's
a
fertility
sign of,
because the ovaries are not functioning, may not be functioning. That may be
Doctor,
the reason
please
why.
let me cut you here. Talking about ovaries, I've heard about ovarian cysts. Can that cause infertility as well?
Yes, ovarian cysts, there's some of them secrete hormones that may affect fertility. But sometimes the fallopian tube itself may be blocked, and it may give an appearance on imaging as a cyst.
Okay.
So when you say ovarian cyst causing, yes, ovarian cyst can, but typically it doesn't.
Okay.
You can have an ovarian cyst and still be able to get pregnant. We do see it a lot when we operate on patients for cesarean sections for delivery. You might find an incidental ovarian cyst sitting, sometimes very big. So to answer that question, ovarian cysts per se will not cause infertility unless we go into the detail of what type of cysts we're dealing with.
Okay.
There is a major group out there called polycystic ovaries,
right,
which is very common in women. It has become very topical for all gynecologists involved in reproductive health. That group of women have special issues that tend to affect fertility and hence may need to seek medical attention.
Okay. How about men?
Men, the issues are also one. The first thing is that the tool must be able to work. So you must be able to have a penis that is able to erect and
That's
be able
a functional one.
that is able to perform its function. That is penetration and depositing semen into the vagina. And if it's not able to do that, that is a problem. And why is it not able to do it? Sometimes it's not able to do it for psychosexual reasons. That is, he and the wife or partner may have issues that turns the man off and therefore may not be able to have an erection.
Okay.
In which case, he has a dysfunction that is not anatomical, but is socially related.
All right.
Then, of course, there are some who may just not get it up because anatomically there may be issues.
Right.
And
I believe that's more common than the cycle.
And then the age.
on that note, doctor, please hold it right there. We'd like to go for a quick break. When we come back, we'll talk more.
Introducing Cerelac Biscuity, the new baby cereal from Cerelac, with a great new biscuity taste that babies absolutely love. And of course, it's fortified with iron to support babies' healthy growth, just like all the other nutritious Cerelac flavors. Cerelac, big nutrition for small tummies.
Nivea Natural Fairness Body Lotion is making women glow with confidence. With a trusted, innovative formula containing unique berry extracts and UV protection to care for and restore the skin's natural, healthy glow. Reveal your beautiful, glowing skin with Natural Fairness Body Lotion from Nivea.
So don't forget your onions, but most importantly, choosing the right oil makes all the difference. That is why I always choose Frytol.
So what's the story behind Frytol?
At Wilma, where Frytol is made, each and every worker wakes up with you in mind.
Really?
And for the millions of other homes too. There, the experts ensure every bottle of Frytol is rich with great taste that creates memories to last their lifetime. That is why I add required amounts of Frytol to taste. Frytol is a cholesterol-free oil fortified with vitamin A.
Now I know why you cook with Frytol.
Yes, and it's the choice of cooking oil in millions of other homes.
Yes, Dad.
Enjoy great tasting meals with Frytol, a cholesterol-free cooking oil fortified with vitamin A. Frytol, love your food, love your life.
This advertisement has been vetted and approved by the FDA.
Welcome back. Optimum Nutrition Care Consult is happy to provide you with all kinds of nutrition and health education, your nutritional assessment. If you have any diet-related condition, hypertension, high blood sugar, high blood cholesterol, etc., just call on 050-151-6186. Back to my experts. Stephen, are there foods that can be dangerous to reproductive health?
I think the answer is yes.
Okay.
Yes, over the past decades, there have been a lot of research around food and reproductive health because of what we are seeing in its effect in chronic disease. I may touch on a few that maybe for general reasons. The first thing I could talk about is what we call trans fat. Research has also shown that when you are trans fat, basically are fats that we get from deep fried foods, margarine, some of our processed foods. So high intake of trans fat can actually also affect fertility in some people. The other thing is carbohydrates. Carbohydrate intake. High levels of carbohydrate intake also affect fertility. So it's also not just the carbohydrates, even the type of carbohydrates. So simple carbohydrates, especially maybe our sugary drinks or food that contain high levels of sugar, they also can impede on fertility. But those are things that we can say that can be dangerous. But more recently, there's this thing that's becoming very common about the intake of unfermented soy or soya product. So the research is showing that taking on soy products can also affect a person's fertility.
Do you think that needs to take a lot of soya?
No, soya, it's a growing thing in our country now, especially people. We are getting vegetarians, we are getting people who want to take less fatty things, so they think that can be an option. So, but one thing that is called phytoestrogen, which is in unfermented soya product, has been seen to affect fertility. Both in men, it can affect the quality of your sperm, and it can also affect the quality of the egg of a woman. But more intriguingly, in that research, all these research were done among animal studies. We've not done anything among humans, but it can tell us what can happen in human. It was discovered that even what you are taking can affect the sexual behavior of your offspring. So the parents...
Does that boil down to the congenital parts Dr. was mentioning?
There hasn't been a direct link.
If what you eat is affecting the sexual behavior, shouldn't it be during the time of pregnancy?
Yeah, so as I said, it's possible, but we've not established that direct relationship. So what I can say is that for the general population, taking soya may not be bad, but if you are looking at conceiving or getting pregnant, limiting your intake of soya product may be helpful in that particular regard. And there are other things that we could talk about which can also help when it comes to lifestyle practices or changes.
I think we'll move on to that. But doctor, at what point does one seek medical help? For example, for men, it could be an erectile problem, so it's easier for them to seek medical attention. But for a woman, or for a woman who has not had her menses for a number of months, it's easier for them to come to the clinic. Is it that there has to be a routine check, or there should be some signs that should take one to the hospital?
Well, if we're talking about sexual health, I mean, we have to make a distinction between having sex and reproducing.
Okay.
And if we emphasize on procreation, which I believe should be the center, if you've been married for 18 months and a couple hasn't had a child, that is the first step. If a young girl is 16 and above and doesn't have regular menstrual cycle, that should be a warning that we probably need to be investigating or following this girl carefully. But certainly what prompts us most is inability to conceive after 18 months of marriage. Today, people are doing it much earlier. They don't wait 18 months. They come earlier because now people are getting into the industry or getting to work after going to school for much longer time. It's not like our mother's time who by 18, 19, 20, they're having children. Now women are having children in 30, 31, 32, 35, and thereafter. So we tend to investigate a couple earlier than it was done in the past. Okay. So I believe that now within 6 months to a year, we would investigate.
Okay.
And for a woman, certainly we want to know how your ovaries are doing. As I said before, your menstrual history may give us a clue. There are other sophisticated laboratory tests that are now being done to actually quantify even the eggs that are in a woman. A woman has as many eggs as they're going to have for the rest of their lives present at birth. Mm. And they use some every month, and the quantities keep going down every month. Okay. So the longer you delay childbirth, the more you find that your eggs are depleted. You are depleting your eggs as you wait. Okay. Men produce new sperms every 74 days. Okay. So men don't have that much of a problem even if they wait long.
So age doesn't reduce sperm counts?
It does a little.
Okay.
Except that with age, we tend to have more. For men, we produce so many sperms, but if we could get 14%, even normal, which means about 86% of our sperms are abnormal.
Oh.
And the older you are, the more abnormal a lot of your sperms are.
Okay. When you say about 86% of the sperms are abnormal, is that normal? Or that's normal for a normal man to have? Oh.
You will have a lot of your sperms have double tail, have big head, have all kinds of things that...
do those big heads give big-headed babies too?
No, you just can't get pregnant with them.
All right.
So we have more, but very few are actually functioning to the degree that they will be able to procreate.
All right.
So men also have issues with numbers, with quality of the sperms, how they move. We generally want to see fast-moving sperms.
All right.
And the quantity.
Okay.
So if the sperms are there and they are not moving, they stand in the same place, spinning their tail at a microscope.
Okay.
And you should be surprised that a lot of you, even younger men, come in and you test them and there's no sperm.
Oh.
So it is an issue that people must get checked. And to go back to the question, yes, couples married for 6 months without a child must seek help.
All right. So you heard it for yourselves. So just get checked 6 months into marriage and be sure that you are safe. We're going for a quick break. When we come back, we'll continue. Welcome back. This is Healthy Youth segment, and today Simon Osu has a question for us. He says, I have low sperm count. Are there foods I can eat to improve? So we've talked about some nutritional interventions that one can have to improve their sexual ability. You know, there are nutrients that, of course, can help contribute. There are some problems that arise from your own body's anatomy. So for those ones, nutrition may not play a lot of role in improving the situation. But of course, you can give it a try, and that can be helpful. So see your doctor, see your nutritionist or your dietitian, and of course, they will help you to get over this problem. All right, so doctor, that was Healthy Youth segment. You know, people have a lot of issues, especially we get a lot of questions from the men as well. Sometimes it looks like fertility issues are usually women problems, but I think that we should have some research done to see some of these causes, what proportion of our population really has that problem in terms of men and women, so that we can really address the issue. Because if we keep looking at the woman, then and when the man is the problem, then we are not going to solve any issue. So when people come like that, are we able to assess the couple, or we just assess the woman and try ways to improve the problem?
No, it's a good question. We normally encourage women to come with their husbands, as the couple should come together. And we try quickly to screen the man, do a semen analysis as a baseline to see where the status is. Okay. And then for the women, we assess ovarian function, we assess to see whether their tubes are functioning. We access the uterus to see whether there are any diseases, fibroids, and things that could affect pregnancy.
Okay.
And unfortunately, fibroids happens to be one of the major diseases involving the uterus that we tend to see. Okay. Hence, we tend to deal with a lot of it. But occasionally, you may even have growths inside the womb itself. That's where the pregnancy is going to be. And we have a procedure called hysteroscopy, where we can put instruments through the vagina and remove fibroids or growths inside the womb that can prevent pregnancy from occurring, even if the husband is okay.
All right. So it seems that we don't have a lot of time. So I'd just like to take Stephen's final words, and then we'll continue with, we have a part 2 for next Sunday. So Stephen, please round it up for us.
I just want to say reproductive health is something that concerns all of us. And as the doctor has said, it's the desire of every human being to be able to reproduce. From where I sit as a dietitian, I can emphatically say that nutrition and lifestyle modifications do play a key role in improving and enhancing your reproductive health. So I will encourage people, especially for couples who are trying to conceive, but it's been difficult. You seek medical attention early, but also remember to seek nutritional counsel, since it may be the link you may be needing, because this thing is an interplay of many factors, and looking at the nutrition side also can go a long way to enhance your chances. So seeing a dietitian may be very helpful.
Okay. Thank you very much. This has been the Wow Lifestyle Show. My name is Helena. Of course, my beautiful wake up, my makeup, and my nails were done by AJ Hair and Makeovers. You can locate them at East Legon, Oponglo. They're in the same building as EcoBank. My beautiful Ankara Petals cape was given to me by Helena Fashions. Call them for all kinds of cape that you may need. We shoot at Aliza Hotel. Affordable luxury is what they offer you. Thank you for watching. See you next week. Bye-bye. My name is Helena.